So this is part 2 of the psychoactive drugs video. Let's continue to talk about the different types of drugs. We talked about depressants. Now let's talk about stimulants. Stimulants are going to do the opposite of depressants. So they are going to excite neural activity. They're going to speed up body functions and neural activity. So making everything that we would normally have happen in our brain speed up, go in quick motion. So the first and two most common are caffeine and nicotine. Both of these drugs increase our heart rate, increase our breathing rates, increase other autonomic functions. So autonomic functions, think autonomic nervous system, things like our digestion and our breathing and our sweating and our heart rate, like all of those things speed up. Okay, it's why we take these drugs, right? We take caffeine in order to make us more alert, make us more like on top of things. Where, if it's an overuse, again, we're going to build up that tolerance. This picture that we're showing right now, though, are some long-term effects of nicotine use. So this X-ray is showing a patient with a vaping habit using nicotine. And it's showing some lung damage or densities associated with the use of nicotine. Caffeine is considered the most widely used psychoactive drug. Almost every person uses it because it's in a lot of the food we eat and a lot of the things we drink. It increases our alertness. That's why we drink it, right? That's why we drink coffee. It improves our mood by mimicking the adenosine neurotransmitter. It's physically addictive, though. We can experience those withdrawal symptoms if you stop taking caffeine. Think headaches, think being drowsy, think being crabby because you didn't have your coffee that morning. I know I get those sometimes. In high doses, though, it can produce anxiety because, again, we are increasing that neural activity, and so it's like increasing all of the thoughts that are happening in your brain. Restlessness, insomnia, and increased heart rate. So these are known as the coffee nerves, but they can happen over time if you take a lot of caffeine. Amphetamines are often referred to as speed or uppers. These suppress our appetite. Once they were at one time prescribed as diet pills, but they are no longer prescribed because our tolerance because of the tolerance. So what happens is like you take it one time and then like immediately the next time you have to take a higher dose. And so individuals needing more and more of the drug over time to maintain that effect of suppressing the appetite. It also increases our concentration and reduces our fatigue. However, it can increase our anxiety and irritability as well. Methamphetamines, or meth, crystal meth is the street drug. It's manufactured and either smoked or injected. As with all amphetamines, after using for a while, you crash because you're on this like high and everything is kind of built up and excited, and then after you use it, that just stops. And the withdrawal symptoms include things like being really tired, sleeping for a very, very long time, being in an intense and constant depressed mood, and a depressed appetite. So you're going to not eat. It's highly addictive. The after effects of using it are irritability, insomnia, hypertension, seizures, disorientation, occasional violence. Over time, it appears to reduce or lower the baseline dopamine levels. So remember, our dopamine is used for feeling pleasure. It's our pleasure neurotransmitter. And so if those baselines are lowered, that means that we have a lower feeling of pleasure in our body at all times. And so it can leave users with a permanently depressed functioning. And again, this is functioning, not a depressed mood, okay? So functioning, again, slowed down mood. Slowed down functioning of the body. Cocaine is also a stimulant. It's derived from the coca tree. It's still used today in anesthetics. Novocaine is often used, especially in dental work. Cocaine was originally in Coca-Cola. That is not a myth. It actually was in Coca-Cola. However, in 1903, it was replaced by caffeine because it has similar effects. However, there are still cola drinks that use the coca leaves to get flavoring. Cocaine can be inhaled or snorted, usually through the nose, and it reaches the brain within minutes. Think about where you're putting it. If you're putting it in your nose, it's like direct access to your brain. It gives an intense euphoria, an intense feeling of pleasure and mental alertness and self-confidence. It lasts for several minutes, usually 10 to 30 minutes if someone is a binge user. What cocaine does is it actually blocks the reuptake of dopamine. Basically, your brain is flooded with dopamine, that pleasure neurotransmitter. And so you get this flood of a pleasure signal, so this euphoria. So some of the side effects include increased risk of strokes, which is a brain bleed, reduced attention, insatiable hunger, insomnia, hypersomnia, lethargy, fever, discharge from your nose. You have throat soreness because you're inhaling and doing things a hoarse voice. Your teeth are wearing away. You have chest pain and asthma and bronchitis and a lot of issues in your lungs. And then you could have a heart infection, and then you could have skin scabs. Ecstasy is another stimulant. It's oftentimes referred to as MDMA or Molly. It's a mild hallucinogen as well, but mainly a stimulant. It increases our feelings of empathy. So we feel really close to people when we take this, and you feel really peaceful, you feel calm or relaxed. However, you also have like an unending supply of energy. So you feel really like good and comfortable in the situation you're in, but you have like this really, really intense supply of energy. That's why it's a popular club drug, because it brings people together. It makes people feel close to each other while giving them a lot of energy to party. This is a really dangerous drug, however, because it has immediate dehydrating effects. So it takes a lot of the water out of our body. And if you use that, plus, it's used in the club, so there's a lot of physical activity, a person can risk severe overheating, increased blood pressure, and potentially death. Over time, researchers have found that a decline in memory and performance on IQ tests when people take ecstasy repeatedly. They believe that MDMA causes long-term serotonin changes. Remember, serotonin is a neurotransmitter associated with our memory. And they believe that it could lead to a reduced level of serotonin, which could lead us to, again, memory problems, and then an increased risk of a depressed mood all the time. Okay, our final type of drug is hallucinogens. Hallucinogens are psychedelic, which are mind-manifesting drugs. They distort the perceptions and evoke sensory images in the absence of sensory input. You're hallucinating, okay? So hallucinations can be any sensory input. It can be seeing things, hearing things, tasting things, smelling things, feeling something on you. Anything like that can be a hallucinogen as long as it's not actually there. We're going to talk about LSD first. It's often referred to as acid. It's one of the most powerful drugs known. It only takes 1/1,000,000th of an ounce to do any sort of altering effects. It was actually produced on accident by a chemist where he accidentally ingested a minuscule amount of the substance and had the first ever LSD trip. When someone is on LSD, we don't call it being high. We say that they're on a trip because they're actually physically feel like they're out of their mind. And it usually lasts 6 to 14 hours. So it's a very long change in your body. Like I said, there's visual distortions, so you might not be able to see clearly. Those hallucinations are going to happen from any sensory input. And then very intense emotions and unstable thoughts. People can have bad trips, which would be kind of like having a nightmare for 6 to 14 hours. So they're usually in a state of panic, or they feel like they are never going to come out of this trip that they're in, and it can end pretty tragically. People can have flashbacks from LSD, which means that like they could have a reoccurrence of that trip weeks or months after using the drug because it stays in our system for so long. So even after just one dose of LSD, someone could have this flashback to the trip weeks or months after it's happened. And then we have marijuana. Marijuana produces feelings of elation. It promotes relaxation. It relieves our inhibitions, relieves anxiety. And then it increases it. It makes our sights, sounds, and touch, our emotions, our senses really, really intense. And it causes a sense of time to be distorted. So you don't have necessarily a ton of idea of how much time has passed. THC is the ingredient in marijuana that produces the high, and it remains in our body for a very long time. 10% of the THC remains in our system 7 weeks after we have taken the drug. Effects, everything that we talked about before. So it's going to impair attention or coordination. It's going to slow down reaction time. It's going to interfere with concentration and logical thinking. It's going to not have an ability, it's going to impair our ability to form new memories and to really remember what you were saying. So you'll like lose your train of thought. A chronic use of marijuana can lead to a chronic loss of motivation and general apathy, feeling like you always need the drug to keep you relaxed. It also causes respiratory damage faster than cigarette smoking. And so it also has a huge effect on our reproductive system, especially in males. Think of stimulants as heightening that fight or flight response that we would have in our body, right? So all of those things that would happen during our fight or flight is going to happen when we take stimulants, and then the opposite is going to happen during that depressant. So influence on drug use, we look at drug use from a biopsychosocial standard. We have biological influences, which could be genetic tendencies to lead us to use drugs, dopamine reward circuit being somewhat off. We have psychological influences, which could be peer pressure or psychological disorders that could lead to the use of these drugs. And then social cultural influences. And I'm sorry, I said peer pressure for psychological. I meant that in social cultural. So just the people around you and the place around you could influence your drug use. Psychological would be how you're processing information. So your thoughts about yourself, your stress levels, and then those disorders that you might be experiencing. The biggest influence, though, on what you experience when you take drugs is actually your expectation of what you expect to happen when you take that drug. And those expectations are based on past experiences, people telling you what you're going to experience. So that is a huge influence on what happens to you when you consume that drug.